For most of history, the human heart was believed to be too delicate to tamper with. It wasn't until the 20th century that surgeons began to discover ways to perform heart surgery safely and effectively. It was known for centuries that the heart is a complex mass of muscle that pumps blood throughout the body. But after many years of scientific research, the intricacies and function of this magnificent organ are more completely understood. However, with damaged valves, clogged arteries, and other problems, it can't work as efficiently and as effectively as it needs to. But with modern science and the highly skilled professionals at Community Memorial Hospital Heart Team on your side, you can expect an excellent recovery and live a long and healthy life. But it's important to remember that the surgeons, technicians, and nurses are only a part of your team. It's important to understand the process of heart surgery and how your participation will help ensure the best experience and recovery possible. As with any major operation, the decision to have heart surgery should not be taken lightly, as there are potential risks involved, including infection, pneumonia, stroke, and even death. So it's important to talk to your doctor about these risks. Share your concerns with both your doctor and your family.
You know, they didn't write a song, "I left my spleen in San Francisco." Okay, I left my heart in San Francisco. No, that's what we associate with life and our well-being.
I'd be lying if I said you weren't scared when you go in. You are. You don't know exactly what you're in for, but it's big and it's serious. So it's a little nerve-wracking when you go in.
Really nervous. I'm really scared. I tell them, well, if you weren't, you'd need a psychiatrist. You're going to have heart surgery. Of course you are. But I try to emphasize that you have a fixable problem.
I can honestly say I wasn't concerned.
Once you and your doctors have decided that you're going to have heart surgery, you'll meet with the patient educator and liaison nurse here at CMH.
Prior to the surgery, I will sit down with the patient and the family and explain what they can expect. It's a process. I try to cover all the bases. So it's an in-depth discussion. It goes on and on because I don't want to leave anything left unexplained.
Kind of hard to believe that you go through on the system that they have in place to get you well again is pretty incredible. They've done it so much and so often that if you follow the system, you get the sense you're going to be okay.
We don't just operate. We do everything before and after surgery as well. We meet the patient, we help decide what's the right operation for them, counsel them about which operation they should have, and then we meet the family, get everyone ready for surgery.
On the day before surgery, there are several things you need to do, so follow your pre-op instructions carefully. When you arrive, you'll be put in a room where you'll take a shower. The nurse will shave you if needed.
They'll be greeted by their nurse, the nurse that's going to take care of them. They'll go through a series of questions and make sure that it is indeed the correct patient, and just identifying that we're confirming what the procedure is, that we all are in agreement.
Once you've been prepared and completely sedated, the cardiac team will begin your procedure. Here at CMH, our cardiac surgeons, along with a specialized physician's assistant and a dedicated OR team, assist each other in the operating room.
We work together on every single case, and that's the style we've always had here.
When I first met Dr. Bushnell, I knew right away that this was a good group to work with. I was looking for a group that really approached their work as partners.
During many cardiac surgery operations, your chest will be opened with a procedure called a sternotomy.
Sternotomies are dramatic looking to many people, but they are actually one of the less painful incisions overall.
It starts healing right away, and by 6 weeks is strong, and by 8 weeks you're back in the gym. And in the interim, you can be real active and walking every day. A sternotomy is the preferred approach for just about every operation.
This median sternotomy through the chest bone is really a pretty good incision. It doesn't move a lot when you breathe. The one down here, the big old gallbladder incisions, those hurt because every time you breathe it moves. So yes, it's going to be uncomfortable, but it's not as bad as you'd think.
The most common cardiac procedures performed are the coronary artery bypass procedure, the valve repair, and the valve replacement. During the bypass procedure, the surgeon will reroute mammary arteries attached to your chest wall to bypass a clogged artery in your heart. They may also use a vein from your leg to reroute blood around the clogged artery.
They're very small incisions. Most people don't have a lot of complaints about their vein incisions anymore.
During bypass surgery, they'll decide whether to use the heart-lung bypass machine or the beating heart technique. The heart-lung bypass machine takes over both the pumping of the blood and its oxygenation, as well as warming or cooling the blood. It is always kept in the operating room, even during beating heart surgery in case it's needed.
I mean, we literally stop the heart. I tell patients, your heart's going to get the only rest it's ever going to get in your lifetime. All right, it's going to have about an hour to just sit there and relax. We cool it way down. And that gets your attention. I mean, for tens of thousands of years, we defined death by the heart stopping, right? So it is pretty amazing that we can do this, that we can operate on the heart, cool it down, stop it, and then warm it back up and perfuse it with blood, and it takes off usually happier than it was before.
The heart-lung bypass machine actually makes the operation safer. It makes it so that we can see everything we need to see and do whatever repair or bypass that we need to do perfectly, because things are not moving and we can do a really precise operation.
If the beating heart technique is used, your heart will continue to beat and your lungs will continue their normal function during your surgery. Heart valve repair or replacement is normally done because either a mitral valve or an aortic valve is not functioning normally. The two most common problems are a heart valve that can't open completely, so that the heart has difficulty pumping through a smaller than normal opening. This is called stenosis. Or a valve that is unable to close completely. This is called regurgitation, which is blood leaking back through the valve when it should be closed. Your cardiac anesthesiologist will perform echocardiography to visualize your heart valve in function before, during, and after the operation. But at times, the surgeon will only be able to decide whether to repair or replace a valve after surgery has begun.
I did talk to the anesthesiologist, who was great, and that's the guy you really want to get to know. You make sure he puts you out well, so I just remember going to sleep.
The cardiac team at CMH is a dedicated group of highly trained specialists who are committed to making your surgery as safe as possible. Led by Dr. Lamar Bushnell and Dr. Jennifer Wan, our team is highly recognized for their success rate and exemplary outcomes.
Well, in 1998, I found out that I had a bicuspid aortic valve that at some point was going to need to be replaced. So I had to confront the question of, where do you go, who's going to do this? And I thought about it, and I really wouldn't consider going anywhere else.
Dr. Wan, she's fantastic. Couldn't have asked for a better surgeon, and she was great with my family, and always had the time to answer questions and, talk to us and make us feel better.
Yeah. I love my wife very much. She's 40 years, we've been married over 40 years, and if she had to have heart surgery, it would be right here on this table in this room. And my biggest problem is who would run the heart-lung machine.
Once your surgery is complete, you'll be taken to the cardiac care unit, where you'll be cautiously monitored for a period of time by specially trained and experienced cardiac surgery nurses.
Right after surgery, patients go directly from the operating room to the critical care unit. They're met by a fleet of wonderful nurses.
That's really probably the second most critical period after the operation itself. And a lot of the complications that can occur right after surgery. And being in the CCU with specially trained nurses and all the monitors we have allows us to recognize those before they happen or when they happen and correct and deal with it.
I just remember actually being in my room in ICU, and I had a private room. It was wonderful, and all the nurses, they were just great. Couldn't have been nicer.
When you awake, the first thing you'll notice is that there is a tube in your throat. It's attached to a ventilator that's supplying oxygen to your lungs. At this point, you can take an active role in your recovery by breathing deeply and following the instructions of your nurse and your respiratory therapist, who will be working with you to remove the breathing tube as soon as it is safe.
Respiratory therapist coming in when she went to go do that, and she says to me, she said, I'm your best friend right now because I'm going to take your tube out. So
I could feel it coming out, and it was definitely a very strange feeling, but I was actually very happy because I was like, yes, finally it's coming out.
You're taken to the ICU you'll be on a ventilator, And I knew I was going to be intubated, and I knew that I was going to wake up with this tube in my throat. And of course, the first thing that the patients do is they cough. And so I knew all about it, and the first thing I did when I woke up was coughed. You know, it's just, and then the tube came out, and I was awake, and it was all over. But I just laughed.
They have to know that their job, their first job after heart surgery, is to help us by getting a handle on getting the secretions out of their lungs. They have to cough the phlegm up. And that is something that we start literally immediately after the respirator tube is removed. So that's where I bring out the incentive spirometer and the heart pillow.
So this is the incentive spirometer, better known as the IS. This tool is going to help patients to go home quicker. If there is a homework the patient has to do, is to work with this. It's very simple, but it's very important and crucial after an open heart surgery. Patients are sedated and they're not exercising their lungs. And this is the tool to exercise the lungs, to be able to take a full deep breath and to move the secretions, to cough up the secretions. This can take you home quicker. So how it works, they're going to take a slow and deep breath, and the piston over here is going to rise. It shows how big of a breath the patients are taking. And this is to mark a goal. What is the patient's goal? 500, 700, how big the breath is going to be. Ideal, patient has to do this at least 10 times an hour when they're awake. So after they do the 10 times, they will cough. And believe it or not, they're going to be able to bring up the secretions. The more they exercise with this tool, the less oxygen the patients require, the sooner they can go home.
Normally by the next day, you'll begin to walk with your physical therapists, which initially may be only by the chair next to your bed, but they'll soon be assisting you walking in the CCU hallways.
I want my patients to actually walk outside the room, not just in the room. I try to get them up to a chair from the day after surgery and walking out in the unit from the day after surgery if possible.
So the first thing we're going to go over is called a log roll. So you'll be using this technique to get in and out of bed, okay?
Okay.
So we're going to go over that right now. So to start, you're going to bend both your knees.
Okay.
There you go. And why don't you take your pillow here, I'm going to have you give it a hug. Okay, that's going to make your chest feel better as we move around.
Okay.
Okay? Next thing we're going to do is you're going to roll onto your left side, but I want you to keep your knees, your hips, and your shoulders all in the same line.
Okay.
And I'll help you as you need, okay?
Okay.
So we'll go on 3. We're going to roll onto your left side. 1, 2, and 3. Excellent. From here, we're going to bring both your legs forward off the edge of the bed. There we go. And I'm going to help with your shoulders to sit up. Good job. How do you feel sitting up here?
Okay. Yeah.
Good.
It is literally baby steps. I mean, you get up, they move you to the chair, and they'll do that. And then by the end of the day, though, they're saying, okay, you can get up and you can walk to the door, and back. And so, and they tell you the more you do, the more you follow this, better it's going to be for you in the long run of your recovery. And then by the next day, you're walking around the nurse's station.
It does depend on the patient. Everybody's a little bit different, but oftentimes we'll try to get people out of bed the same day of surgery, if not by the next morning.
So I got up, started walking, and then did a couple laps, and felt pretty good to get back in bed again, and then it got easier as it went.
The only way to get through it is doing it again. And it's not great the first time, but then the second time's a little bit better, and the third time's a little bit better, and a few months later, you're right as rain.
After the doctors and nurses have decided that you're ready, you'll be moved to the telemetry unit.
The difference in telemetry is they're a little bit more independent than they are in the ICU, so a little bit more self-care. They can get up, go back and forth to the bathroom, get out of bed, that type of thing. So it's a little closer to how it would be when they go home.
We absolutely encourage our patients to do as much as they can in terms of activity and walking. So whether that is working with physical therapy and occupational therapy once or twice a day, we encourage them to do that even if they're feeling tired. We say, you know, this is really important and it's really going to make you feel better in the long run. We'll encourage patients to get up with meals, you know, so even just that little movement of going from laying down in the bed to sitting up for a meal, that's more movement than they would do had they not gotten up. And it puts you in that nice upright position, you open your lungs, and you just feel better. You're sitting up in a chair where you usually eat your meals just like at home.
Our physical therapists, they get on it, and patients will sometimes say, I don't feel like getting up, and our more aggressive nurses say, that doesn't matter. You're getting up and going. You know, we tease them, they're Nurse Ratchet, but the patients end up appreciating it because they get better quicker, and they know that everybody there has one goal in mind, and that's getting the patient better as quick as they can, the least complications.
One of the best things that Dr. Bushnell does is when you go in to see him for his checkout, he gives you a pillow, and it's a heart-shaped pillow, and he diagrams your surgery, and then he signs it like it's a piece of artwork, right? And you're going, well, this is nice, but you come to love that pillow because every time you cough, sneeze, move your chest, you have that pillow and you hold it up against your chest.
You've now reached a milestone in your recovery. You're going home. But don't expect to be back to normal just yet. There'll be discharge planners at CMH working with you and your family to make sure you have the support, equipment, and follow-up that will help you continue your recovery.
I help with the transitioning out of the patient out of CMH, whether it's going home, going to a tertiary care, going to a skilled nursing facility. We just want to make sure they're safe when they leave the hospital.
I think the first day, the day of discharge, is incredibly powerful and difficult for both the patient and the spouse.
He had to sit in the back seat of the car, so I had to get him in and out of the car and
with my pillow
and into the house, and he needed to be able to go up and down stairs. And he was moving around pretty well by the time he came home.
The first day, nobody knows. The patient doesn't know how far they can push themselves. The spouse has no idea what their role is really.
We get cared for, and we get, everyone's taking care of you, and you're just kind of a slug going through the process. But she's active, and she's worried, and she's trying to figure out what she can do and trying to make a difference. And I think it's really difficult. I don't think it's an easy process.
I was nervous about him coming home. I really was, because now you're on your own.
And that may last a day or two. And I always tell them, you're going to be so exhausted from worrying about what you should and shouldn't do that you're going to get to a point where you just say, oh, the heck with it. And you just start figuring out each moment. And I say, that's when things start to go better for you. And that's okay.
The first couple of days when I got home were really uncomfortable. It was partly just trying to figure out how you could sit, how you could relax, how you could just get through the day, because it's kind of a waiting game. You're just sitting there waiting.
I think sleeping was more of a problem for me than anything.
Yeah, he had.
And part of the time I was sleeping in a lounge chair.
I think it's exhausting. The whole process of a big operation like cardiac surgery is a marathon for anyone. It's one of the biggest stresses on their body that they'll ever have. But getting back on your feet and getting up and getting around is part of the recovery and important.
But again, it's the first 4 days home are 10 times better than the first 4 days in CCU. So every 4 days gets exponentially better.
Now is the time to really take control and recover through rest, exercise, and diet and stress management.
When you leave the hospital, the focus is on slowly returning to your regular activities that you have at home, getting up and getting around, having your pain controlled, as you said, resting from the big stress that you've gone through and are recovering from.
They can't sit in front of the TV for 4 or 5 hours because it's comfortable. They have to get up and move around.
Sometimes people feel so good after their heart surgery because everything is working so much better that they just kind of want to get going. But it's important to kind of grade that return to activity and return to exercise. And again, there will be restrictions such as limiting pushing or pulling with the arms, lifting, and also how high you can reach overhead or behind you. So those tend to limit people for a while as well.
I was walking her, our dog, 2 days after I got home. So even though I think I wasn't supposed to, but I did anyway, because I felt so good. And they said I actually, depending on how I felt, that I could do, mild activities. So I did. I started walking her a couple of days after I got home.
My wife would give me a ride down here, and I would kind of sit here for a little bit and do some things. My staff called that adult daycare.
Once you're home and feeling better, you should talk to your doctor about attending the rehab program here at CMH.
Cardiac rehab is incredibly structured. It is a very safe, secure environment, well monitored, and it gives the patient something to get them out of bed in the morning, and it gives them something to look forward to, and they know that they're going to start gradually and just simply progress forward as they tolerate, because that's the way the program is designed. We have no prior expectations of what a patient should or shouldn't be doing.
And I think it actually gives them a little support network too, kind of form a bond with the people that have been through the same experience as them.
It also helps to be with other people that have had heart surgery and see how well they're doing. We have a psychologist that talks to folks about how you might be feeling about things.
Patients ask about life after rehab, and what we tell them is that if they're local, they can check out our fitness center here at the hospital.
After cardiac rehab, this is a great transitional phase, so we can keep the process going. We have various cardiovascular machines, treadmills, bikes, elliptical trainers, and so forth.
Diet is important for everyone. It's not that different than what happens before surgery. It's still maintaining a healthy, low-fat, low-calorie kind of diet.
Really what's been proven in multiple studies to be the best heart-healthy diet is a Mediterranean diet, which is a great diet. I mean, that's something around here, especially where we can get fruits and vegetables year-round, we can get fresh seafood. It's easy to do, and you can eat gourmet at the Mediterranean diet, but it is important. And I tell patients it's not important what you eat once a month, it's important what you eat every day. So if they want to go out once a month and have a big steak, that's not going to affect their overall diet, but it's what you eat every day.
We also have a lot of diabetic patients, and diabetic control, being on the right diabetic diet and controlling blood sugars is really, really important after surgery.
If your blood sugar is elevated, it promotes risk for infection. So it prevents the healing by making the incision very sticky, and so it doesn't close well. It's so critical. It's not just about medications, whether that be pills or insulin, but also diet. No matter what your treatment regimen is, you have to follow the diet. You cannot just eat whatever you want. It doesn't work. In addition to that is being active.
Well, and it's like everything else too. You need to participate in the recovery. You need to get out and get going, and you can't just sit on the couch and eat bonbons. You need to, get going. But it's well worth it.
And so I did change my diet, and I did start exercising a lot more.
Because, they told me it's really important to, not just sit, to move around. It's good, that's, if you want to heal and get back to where you were, that you needed to do that.
Heart surgery also carries with it an emotional component that every patient will deal with in his or her own way. But there will be help and resources provided to you to help you and your family cope with these feelings and concerns.
There is a very big emotional aspect, and I think that's the part that surprises people the most is during their recovery, how emotional you kind of become after everything.
I mean, this is for most people, they actually, maybe for many for the very first time, had to accept their mortality.
My wife felt scared out of her head. she had a really tough time with it. It was really dramatic.
We had talked a lot about it. We talked a lot about the stuff that I read that was talking about depression can be part of this. So we had an idea of what we were facing, but I think your partner has to really know that for a few weeks you're gonna be down, and it is a road to recovery.
Heart surgery is the beginning of a new, healthier chapter of your life. Take this opportunity to learn as much as you can, and with the support of the CMH Heart Team, be an active participant in making the years to come your best yet.
I feel really good, really good.
After you've gone through the whole process of healing and you're 3 months down the road, you feel like you're all brand new again.
The best thing about the job is that every day you get hugs and appreciation from so many different people. It's great.
You are my sunshine, my only sunshine. Make me happy when the skies are gray. You never know, dear, how much I love you. Please don't take my little sunshine